this session, we're going to look at nursing philosophy and theories. And in this session, we should be able to explain the meaning of philosophy of nursing, the metaparadigmatic concepts of nursing. We should be able to outline the major theories of nursing, and then explain why nursing philosophy and theories are very important in the practice of nursing. So when we talk about the nursing philosophy, we are basically referring to the beliefs, the values, the assumptions that guide the practice of nursing. So basically, for everything that nurses do, they rely on values, beliefs, and principles. Okay, so every decision has their foundation in the elements of nursing philosophy. Okay, so what are these elements? One, we have the humanistic perspective, where nurses treat every individual with dignity and respect, regardless of their race, their socioeconomic status, their tribe, or any other defining characteristic. They treat people with respect and provide care that is patient-centered and compassionate. And then the second aspect is what we call holistic care. This is the understanding that health has dimensions to do with physical, emotional, social, and spiritual aspects. So with this understanding in mind, the nurse recognizes that health is not about the presence or absence of a given disease, but a state of well-being in aspects to do with physical, emotional, social, and spiritual aspects. And then the other element of philosophy of nursing is the principles or ethical principles. This is the recognition that nurses should follow the ethical principles in provision of care. And these ethical principles relate to one, beneficency, which is that you should do the best or should do good to the patient. And then malfeasance, which is that you should not harm the patient, shouldn't do anything that will harm the patient. And then we have autonomy, that the patients can make their own decision about health matters that affect them. And then we have justice, which is that you should treat all people fairly and equally. And then the other one is that nurses should provide care in a compassionate way. They should show empathy and genuine concern for the well-being of their patients. This is actually very important to have the a caring attitude, because we have already understood that health is not only about treating the disease. Health also has dimensions to psycho, to emotional being. Okay, so that means that you need to have that emotional support that you can provide to your patients. So you need to provide care that is compassionate, okay, that shows empathy, okay. This is when now you will be able to improve the patient's emotional well-being. We move to the next aspect, which is patient advocacy. This is a commitment by nurses to always act in the best interest of the patient. Okay, should always make sure that the patient is receiving safe, effective, and respectful care. And then health promotion and prevention is one that emphasizes that nurses should improve or should empower individuals and communities to make more healthy choices and prevent diseases. Okay, the focus here is on prevention of diseases and making people in control of their life, okay, or their health. Another element is that nursing is a dynamic field where new information, new knowledge emerges from research, and all nurses should always be updated with the latest evidence. And therefore, nursing requires one to be a long life learner and be able to practice what we call evidence-based practice. And then nurses should work with other members of the healthcare team, and therefore they should be able to work collaboratively with them such that the patient achieves the best or best possible health outcomes. And then nurses should be culturally competent. And this is when nurses exhibit tolerance to diverse cultural backgrounds. They can work with people of different cultural backgrounds, and that they can provide care that is culturally sensitive to patients' beliefs, values, and customs. So let's move to what we call theory, model, and concept. A theory helps in explaining or predicting a particular phenomena based on empirical evidence or logical reasoning. So here, we are basically saying that for a given phenomena to occur, there are many related propositions around this phenomena. So a collection of these propositions or concepts to explain how a given phenomena happen, or to predict how a given phenomena would happen using research or what we call empirical evidence and or logical reasoning is what we call a theory. Okay, theories help in explaining phenomena. Okay, phenomena being any situation. Okay, for example, an example of phenomena could be nursing care. Okay, how do you explain the relationship between the nurse and the client? Okay, so that is a phenomena. So theories tell us how that relationship progresses, what are the determinants of this relationship, and what are the things that will influence the actions of the nurse and then the actions of the client. Okay, so that is a phenomenon. So different theories help us to explain that. Okay, so we can have a number of different situations that need to be explained using theories. And then we move to what we call a model. A model is a simple representation of a theory or a phenomenon that highlights its major features. Okay, so where you have a theory that could be complex to explain in words. So therefore, you decide to simplify it by using arrows to illustrate how the elements or the concepts, which are basically the basic elements of a theory, or a theory is made up of concepts. Okay, so when you have these concepts and illustrating them using arrows, how they relate to one another, that becomes a model. Okay, so like we have said, a theory is made up of concepts. So the concepts are basic elements of a theory or a model that represent an abstract idea. An idea that is basically in the mind, that is not physical, that you can't even touch and feel. So another term that can be related to a concept is what we call a construct. Okay, so with a construct, it is a deliberately invented or adopted concept for a specific scientific purpose. So it is a construct is more complex than a concept. Okay, and you actually make it. You derive a concept. I mean, a construct from a concept. So you can actually have many constructs. I mean, many concepts that can form a construct. Okay. So this is to say that constructs are also elements of a theory. So they are part of the theory. Okay. So we can talk about a theory, and then inside the theory, we have concepts and then constructs. Okay. Or we can basically have the concepts alone. Or basically we can have also the constructs alone. Okay, so the distinction here is that the constructs are more complex and they are non-observable. You can't see them and you can't measure them. Okay, for example, pain is a concept because you can measure it using different scales, whereas the construct of suffering is subjective and multi-dimensional. So you can't really measure it. Okay, so it is a construct. So nursing theories, a collection of different concepts that explain a given nursing phenomena. Okay, they are very important because they guide our practice as nurses. And then the models, like I said, the nursing models are representation of the reality that depicts the relationship between or among nursing concepts. They also help us to organize and apply nursing knowledge in specific situations. So nursing theories help us in practice, whether it is in nursing education, whether it is in nursing research, whether it is in the real practice of caring for patients. Okay, so to simplify those theories, we can use nursing models, which is basically a representation of the theories or the reality and how the different concepts relate to one another. So nursing theories and models are very key because they allow us to really understand the relationship between what we learn in theory and practice and what we really practice. So we use the knowledge from the theories to be able to relate it to what we do. Okay, and we incorporate a number of theories in caring for our patients. Okay, we can't always rely on one theory to provide care. Basically, we integrate the knowledge from the different theories to be able to provide care. We use nursing theories to guide our practice. In research, you can conduct your research based on a particular theory or based on a combination of nursing theories. And then we can use these theories to conduct research and therefore be able to generate new knowledge about nursing care and improve nursing health and nursing outcomes. So later on in our subsequent presentations, we'll look at the different theories one by one, and these are the most prominent ones, but of course, there are others. So we shall look at the environmental theory by Florence Nightingale. We'll look at the nursing need theory by Virginia Henderson. We'll look at the care chore cohort theory by Lydia Hall. And then we'll look at the self-care theory by Dorothea Orien. And then we'll look at the theory of human caring by Jean Watson. We'll look at the transcultural theory by Madeleine Leninger. We'll look at the patient-centered approach to nursing by Phil Barker. And then we'll also look at the Hildegard Peplow interpersonal relations theory, and then Imogen King's goal attainment theory. Okay. One thing that you need to realize that all the theories explain the interaction between the nurse and the patient in order to improve nursing outcomes. Okay, so the key elements which we are calling the meta-paradigmatic concepts of in nursing are the ones that we shall look at, are the ones that each theory looks at. Okay, whether all the theories that we have just mentioned look at the interaction between these four meta-paradigmatic concepts. So we have patient, the person, the environment, health, and then nursing. Okay, so we look at the first one being the person. It can be a person, an individual, it can be a family, it can be a group, it can be a community. Basically, those who are receiving nursing care. Nursing care can be provided to a single individual, family members, or a family, and then a community as a whole, or a given social group. And then when you talk about the environment, we are referring to the physical, social, cultural, and spiritual factors that influence a person's health. That is what we mean by environment, and then health being the dynamic state of physical, mental, social, and social well-being, and not merely the absence of disease. Okay. And then nursing now being the profession, which basically is the art and science of promoting health, preventing illness, and caring for the person in collaboration with other healthcare professionals. Okay, so we have come to the end of the presentation. We have looked at what theories are, how they help us, what are they made of, and why it is very important to understand the concepts that make up the theories. Thank you very much.